Foundational skills are the hallmark of cognitive processing therapy, and extreme avoidance is a key element of post-traumatic stress disorder. Therapists and clients must be sensitive to their own avoidance mechanisms, and it is critical that they both deal with them throughout the course of therapy. For the therapist, this may involve consultation with another professional, and for the client, this would involve the therapist constantly urging them to complete homework assignments and to thoroughly write the impact statements. Patients can attempt to avoid talking about their traumatic event in numerous ways, including changing the subject, minimizing aspects of what happened, forgetting to do a practice assignment, or even not showing up for scheduled sessions. Sometimes overcoming this involves being quite direct with patients and labeling it when it happens. Therapists themselves may avoid uncomfortable material, and when this happens, they should really seek consultation. And this is particularly prevalent amongst inexperienced therapists. They may try to protect the patient by overlooking or ignoring their lack of compliance with therapeutic goals and homework. Stuck points are defined as conflicting beliefs or strong negative beliefs that create unpleasant emotions and problematic or unhealthy behaviors. It is the therapist's job to identify these as soon as possible. Research shows that most people recover from trauma within a few weeks, and if not, it's probably due to an unresolved stuck point. Stuck points are connected with an individual's core belief system. The traumatic experience will either reinforce a core belief or conflict with it. And there are three ways in which prior beliefs are resolved, and this can be either adaptively or maladaptively. One way is when the client alters their view of themselves or the event to fit prior beliefs. Another is when they change their prior beliefs in an exaggerated fashion. And the third, which is the ideal, is when clients modify their prior beliefs to incorporate the traumatic event without abandoning a positive worldview. Socratic dialogue is a crucial component to supporting survivors of trauma in exploring and reconstructing their faulty beliefs about the event. I'll just cover two of them for the sake of time. One of them is probing reasons and evidence, which is when you ask patients to examine the evidence to support their beliefs. This one is particularly important because it happens quite often in reviewing homework assignments, but also because near the end of the therapy, the patient is encouraged and empowered to be their own therapist. And in order to do that, they need to ask themselves probing reasons with evidence. Another one is questions about questions. And this refers to when the client will ask a question to the therapist that may be inappropriate or in an effort to derail what's happening in therapy. And in this case, the therapist would turn around and ask a question of the client. So not to directly address what the client said, nor to derail the therapy. But the complexity of Socratic dialogue is often underestimated. Therapists have to resist the urge to simply tell the patient what conclusions they want them to arrive at. And given how often Socratic dialogue happens, the intensity and the frequency with which it happens throughout therapy, it's really important that therapists hone their skills in this area.